During the last topic, we covered patient recruitment, and it was kind of a hot topic. But now I have another topic related to patient recruitment, remote consenting. So I have a few questions over here that I drafted. And the first one is about how prepared sites are to do remote consenting service. We all know that eConsent is in the center of direct to patient recruitment and in the center of the centralized clinical trials. So it's key that sites are prepared, but are they really prepared? And any best practices, how they can actually get prepared?
It's a great question. I think when I think about e-consent, there's a few layers that I'm a study coordinator by trade. That's like my special magical powers is as a study coordinator. And when I think about consenting, I flash back to instances of me sitting in the exam room with a clipboard, with an investigator, with a patient, and being the person who keeps literally physically a hand on the page of the consent form and goes, next page, next page. Wait. We didn't talk about this, Dr. So-and-so, please, can we go back, right? And so part of facilitating the informed consent process is making sure that that is a truly informed consent process. The industry talks about the informed consent chart note, or the informed consent documentation of the timing and all. But at the end of the day, is that really a quality control measure of how the consent process actually went? Unless you're truly and effectively training study coordinators to understand that the clinician is so used to signing hospital consents, and the massive difference that there is when obtaining informed consent for research, you can expect that clinician to come in and just breeze through a consent form. And in fact, that's not the way it should actually happen, right? So when it comes down to e-consent, one of the things that makes my palms sweat is how are we going to actually ensure, okay, that the patient has undergone an informed consent process that is true to, say, having that study coordinator literally going page by page and making sure that they're the person in the room stopping the clinician and saying, wait, hang on, patient, did you understand this? Is there anything else we can address with this? Were there any concerns? How do we read the nonverbal cues, right? If it's a true e-consent, how do we gauge that the patient is understanding, or rather just flipping through the consent form, right? Because when you're in person, you can pick up on the nonverbal cues of the patient looking around the room, maybe looking a little uncertain, and you can press on that and say, wait a minute, remember this is voluntary. Remember that you're in control here. We want you to feel empowered. And so I think for me personally, there are e-consent tools that just fall slightly short of that for me in the vetting process. So I think those are my 2 cents on the topic.
And I think, that this is a shout out to Daniel and Macro, and why I love getting to work with you guys on issues like this, because that's exactly what regulatory wants to know, right? Like what we preach, and rightfully so, is informed consent is not a document, it's a conversation. And it's not a one-time conversation, it's an ongoing conversation for the entire time that any patient is associated in any way with your trial, right? Because exactly like you said, we want to empower that individual. We want them to know they are always in the driver's seat as it relates to the research. And so it's not so much from a regulatory or compliance perspective about whether or not you do it physically in person, whether you do it over an email, whether you do it over Zoom. It's far more what Daniel got to, right? Which is it truly still a conversation where privacy, confidentiality, voluntariness, right? Like all these paramount issues are being not only performed, but then of course documented. And so that's the hallmark of what you're looking for in whatever format you do. It's not as if IRBs, FDAs, and presumably EMA, right? I don't want to speak for them, are going to come out and say exactly like we'll be okay with A, but not B. They want you to demonstrate in your product, or frankly, in your process. Maybe you're not using a vended product. Maybe you're getting creative and you're a small site and you're going to use a combination of technologies. As long as, again, privacy is paramount, volition is paramount, you can show, right, exactly. You can show that it is a conversation that is protected, that core paramount part of consent that we hold so highly, right, and so integrous. As long as that's valid, then we're going to get on board. It's not about one particular modality.
Yeah, and I think what I've seen, and because this is extremely relevant to us as a technology company, we're looking into an eConsent, and so we did some research into the market as to what kind of solutions people are looking for. So on the one end of the spectrum, you have here's a document, let me put in DocuSign or HelloSign and send it out, and it's that's what you do with terms and conditions. Just click here, right? And on the other end, you have a new approach, which is more multimedia. It's visually more captivating for the patients. It's got video components to it, hyperlinks, got quizzes, much richer experience and much better way to build in that understanding. What I have heard from other people who have done this before is that the latter, the multimedia experience, actually did encounter some resistance in the industry because it's new, because it's different. And so this is a typical situation where you run into the usual industry resistance to pioneering this. So I would think the latter would be much more compelling.
Absolutely.
And quite honestly, if the demand is not there, then vendors like myself, what do you think we're going to build, right?
Yeah,
we're going to build the simpler solution.
Yeah.
We're going to actually ask exactly that. Why not we just record the whole session, the whole conversation? Obviously, we have to ensure the privacy of the recording, but in the end of the day, if we want to ensure that there will be a conversation and everything, like that's the ultimate solution. But I wonder, actually, when it comes to privacy, is that something that we can cover, like tracking this conversation in a way, and that basically making sure that this won't go out basically so simply?
Yeah, so the big deal about that is, especially like in the United States with HIPAA, is you need to know that if you're going to use some type of a multimedia platform, that it's a protected platform that can't be hacked. And you have to think about the implications on the one side of documenting, such as recording the conversation, up against the risk of the fact that if that recording is stored improperly, is hacked, is not encrypted, you're not using the correct platform, now you've actually endangered confidentiality more than you've protected it. And that's a really fine line. I think we're still, in the United States, we're definitely still kind of bartering over what platforms will meet muster and what won't. It's not as if our regulatory authorities have come out and said, and frankly, I don't expect that they will, because they usually don't, like, this is 100% HIPAA compliant, or this is that's not quite how it works. The big deal from the regulatory angle is, anyone can come out and say they're compliant. When you apply their vended product to your system, did you actually validate that it's compliant with the way that you're using it, the way that you're applying it? And that is why your regulatory agencies say, we can't come out and say, hey, Zoom is always compliant, because it's applied different ways. And some ways it's applied would be compliant and some wouldn't. And that's all at the organizational level. So it's you know what I mean? Like, it's a vicious cycle. I don't think it's that regulators don't want to be helpful. It's just that the devil's always in those details there, right? And that's what you're getting into. The part I think about too, especially as it relates to our prior session on, decentralized trials, will we reach different groups of individuals that are lower in our recruitment pools now, et cetera, is, so on the one hand, you have this multimedia setup, which I'm thinking, for me, great. Are you kidding? But I already have 3 screens and a Zoom setup. And this was all in existence pre-2020. I'm not afraid of that, right? I love that I'm getting my healthcare via telehealth right now. I'm like, why weren't we always doing this?
Yeah.
What about, like, Daniel, you always use your mom as a great example.
Yeah.
Would that actually be overwhelming for her?
It would be extremely overwhelming, because anything more than just click here and taking you to the immediate video page without having to put in anything is a deterrent. It is a 100% deterrent. And it's not about intelligence per se. It's just about capabilities, right? And the other part of that too is the language barrier. And when you talk about language barriers, you can't talk about language without the cultural component. It's not just, are we speaking the same language, but am I meeting you culturally? Am I culturally competent to facilitate this conversation? That's why our partnership with Cloudbreak Health and the use of Marty at Macro Trials it's such a game changer, because you're talking about language access services that have existed in the healthcare space for healthcare needs for clinicians but has been so lacking in the clinical trial arena. I think having a lot to do with what Raymond, you were talking about, the risk averse of like, oh, well, we're not going to try it because there's so many I's and T's that need to be dotted and crossed and buttoned up that frankly sites are not incentivized to do it. Because guess what? When it comes, you want to talk about our previous session about site feasibility, we're not going to be compensated any differently for having done that work than a site that hasn't. And at the end of the day, will you include non-English speaking participants? Yes, no. It's not going to make a difference, right? For those site budgets and feasibility. So we touch on a lot with the eConsent about access and the compliance around it and how effective it's going to be. And I think there's a lot of conversation that needs to still happen.
I'm listening to you and thinking like consent solutions, like what sort of solution, the language and cultural differences and like translation services and all these things that make like sound the e-consent and like any consent, if you ask me, really complicated. And I wonder, is that within the scope and should be within the scope of the site to decide which type of services they are to use?
Great question.
Or you think that the sponsor or a CRO should actually make this decision? And if it's the sponsor and CRO, here I'll challenge you.
Yes.
If it's sponsor and CRO, wouldn't the sites end up with multiple solutions to use and not knowing what to use for which trial?
Maya, you touched on a great topic because that has happened to us at Macro, where we've invested in technologies, we've invested in processes, and then we get a sponsor that's finally turned on to innovation. And they come to us and say, oh, no, we're not going to use any of that. We've already decided that we're going to go with this vendor. And so here you go. And so it's like this mandate of, no. I get that you think that's cute. That was great. We're moving with this vendor. And so that can be very frustrating. When you want to talk about, I know at some point we're going to talk about the role leadership plays in developing emotional resilience in the process of change, right? But that can be very demoralizing to site staff that's very excited, very passionate about their processes, the technology that they've invested time to learn and to implement into their workflows, and to have a sponsor come in and say, that's not how we're going to do it. We're going to plug you in via the CRO to this vendor, to that vendor, and this vendor. I think one way to do it is to have those available, but offer the flexibility in saying, do you want to use it? Great, yeah. Here it is. If not, talk to us about your process, and we're going to meet halfway with it.
Yeah.
Well, and that attacks the ethos of it, because that's the deal, is if you continue to put, and it's not that I am anti-sponsor by any means, everyone has a role to play here, right? And none of them are that easy. But I do think that from a compliance perspective, where I see sites struggle is that the mentality for so very long has been, we are beholden to the sponsor. They have the money, they fund us. If they say use this system, we use this system. If they say this patient gets an eligibility exception, they get an eligibility exception. And things like IRB and some of the compliance, it's not willful negligence, but it's as if the sponsor is really the one who, blesses the trial, right? And allows you to do things. And that's not actually true regulatorily. And it's where you start to get into trouble. I also think it has a certain ethos about the sponsor, owning and controlling the sites that sites, like Daniel was saying, don't usually push back on.
Yeah.
It doesn't set up a good space.
And yeah.
But we want to move away from that.
Yeah, and correct me if I'm wrong, but I believe the informed consent is a process between the local principal investigator and the patient, right? So this is probably not something that you could centralize the way you could centralize an EKG read or lab read, right? This is very localized and personalized. So at the end of the day, it's a process that the site has to own. So it seems to me that I think we're, given that there, this whole eConsent process, remote eConsent, is relatively new, and there doesn't seem to be established standards, and it's ultimately on the PI to establish compliance. It seems to me that sites really ought to be practically thinking about, what is my remote consent SOP? What does it look like? How can I create a documented process that I can follow, right? That provides the glad you like this. That provides the comfort that I can do this. I'm not sure many sites are ready to do that, because that's the sites having the mentality that Dan has, but most don't, where I take control of my destiny and I own my processes, and I'm not going to wait for a sponsor. So I can sort of see sponsors saying, okay, well, for every Dan, there's 30 sites that don't have a clue. And it's going to be on me to come up with an e-consent process if I want to see e-consent and take advantage of decentralized. So I think there's some tension there. The people that bear the ultimate responsibility for informed consent it's a fragmented small business, right, market, and so they don't necessarily have the capabilities or the mentality to sort of develop that next, that process to support remote consent properly.
I'll also say just one more thing, Raymond, that I have seen is when we do come forward with our tools and with our processes and with our technologies that a sponsor's already had another vendor. The other thing that I see that drives me it puts me in orbit, as Edie said, is when they say, okay, great, we're not going to pay for it though, because we already offered something and it's not our problem that you didn't take us up on it, so we're not going to bear the costs of the technology you have. So wait a minute then. Okay, so are we incentivizing the industry to do this? Are we not? Is the stance that sites should take a passive role and just wait around for us to be told? So there's conflict there, right? So we have to go in there then, and then that's when I say we need to set up a conference call and have a dialogue around this, because that makes no sense. You can't say we won't reimburse or support, the costs of our operating costs because you decided to offer technology. But guess what? We've been prepared, right?
Yeah, which is why the sponsors should be negotiating more variable budgets. If the tool is offered on an opt-in basis and they have a per opt-in pricing model, it incentivizes the vendor to come up with something that's appealing to the sites that they're offering to. So, and if the sites have their own system they like better, then they get that funds instead. I think that's eminently fair and reasonable.
I think from a reality. Oh, go ahead, Maya.
Sorry, I just wanted to say that we speak about safety as well. In the end of the day, I was going to actually refer my question to you, Edie. In the end of the day, if the site is working with multiple tools and multiple vendors, that might have kind of like interact with the whole execution and the operation of the site and operation, something that we will touch upon in the next topics. But I would also assume that it will be hard to have standard operating procedures if you have multiple tools with multiple standards. Any good practices, like, have you seen anything happening in the space that like you could overcome this challenge?
And I'll talk about that, and you guys keep me honest and accountable, as we spend more time, because I know we have kind of a whole section devoted to regulatory, but that's something that I really preach about SOPs. You can set yourself up for some flexibility if you're really careful about your verbiage, in terms of, so you say the study record, don't say electronic, don't say paper, or instead of saying whatever the vended product name is, just say the CTMS. Or so that no matter if you change over time, right, your process should stay the same, right? Now you may have to go in truly and change it because the actual process may change. But for the most part, you can get away with not having to change it quite as frequently to update it, right, in that regard. Because really the key there is it's about you have thought through every angle of and chosen a particular vended product that meets that regulatory muster that keeps a patient truly in the driver's seat and safe and, protects their privacy. And then you're crafting your SOP around that. You're not doing it the other way around. You don't want to write your SOP and then, you have to try to plug everything into it. It's the other way. It's supposed to document what you're doing, not prescribe what you're doing, right? That's the whole point. And to that end, I think and this is kind of like what Maya was saying with patient recruitment, like we're not here yet, but this is my big goal. This is my hope that, before I close my eyes for the last time happens in our industry. And that is informed consent's out of control. And it's the lawyers. Like, here you go. I'll totally own it, right? When I work in oncology specifically, your average oncology consent form in the United States is over 40 pages. And you're usually talking to a patient whose options have run out in terms of clinical care, and their other option is death. Okay. I had so many different PIs, nurses, and coordinators over the years tell me that the patient literally says to them, I don't care what it says in there. I'm going to sign because I don't have any other choice. I'm here to do this trial. I made my decision in the car 3 hours ago on my way over here. Okay. So just tell me where to sign. So the idea that informed consent, the way it's set up, even in a pre-COVID, pre-2020, pre-remote world, that it's meaningful and that it's truly meeting the ethics driven standards and roles that we wanted to meet, it was already broken. We already have a real problem there, and we know it at every level. I mean, sit through an IRB meeting where they're trying to analyze an informed consent and break it into 8th grade language standards for 40 pages. It's painful. And so I think that if the sponsors and the sites could align the way you guys are talking about, work together in a really flexible way that, again, shows safety, shows deep consideration for volition, this could be the moment that they use their combined power and influence to say, as we move into remote informed consent, let's talk more about how it's actually informed consent. And let's focus less on, let's say I have to make sure that we click on each 40 page, right? That's stupid. And a multimedia system is only going to make that more complicated. And you're going to have users like Daniel's mom who are going to go, absolutely, screw that. So instead, what if it was more about the conversation? What if it was more talking? What if it was more using diagrams or presentation slides or pictures? I know I went to a great conference. This was probably like 2013, 2012, where we were talking about international informed consent when you're working in trials across multiple dialects and multiple cultures. And some of the coolest things I saw is that instead of being tied to the written page, investigators and their teams had models, they had diagrams, they had pictures, they had a giant whiteboard. They made sure that the person understood. I mean, they followed all the rules for having appropriate translators and, all the other steps, but they took the time to really explain it. And I think if we could work that in, you could revolutionize informed consent to actually be what it's supposed to be.
And
instead of
That's super inspirational. I was actually, while I was listening to you, I remember of one company, there were actually multiple, because you know that almost every single clinical trial has to be done in a pediatric setup as well. So for the pediatric studies, they have no choice, and that's where they spend more effort. And most of the pediatric informed consent, like pediatric studies informed consent, look completely different, so much more enjoyable and so much more understandable. And I was thinking about the amazing type of videos we have on TED Talks and all sorts of videos. Like there are people doing magic, and I'm sure that we can do it also with informed consent.
And I think you could do, I don't see any regulatory prohibition if you wanted as a site or a site sponsor, relationship, to have like an informational video that had a lot of explanation, that talked about the trial, that was pre-recorded, well-produced, well-researched, well-presented, that they could watch in advance, they could watch on site. It doesn't take the place of the informed consent conversation, but it would add to the conversation.
Absolutely.
And that's something they can do on their own term, on their own time, make it something that can be done on an app, on the phone, on the laptop, whatever they have access to. I think if we could use technology in those types of ways, it could not only increase truly informed consent, it could actually increase efficiency.
Think of an airline when you hop on the airline. American Airlines does an amazing job because they broke away from the traditional buckle, and they did a whole thing around it. And they interweave culture and storytelling. And I think human beings, there's something to be said about how we lean in to the storytelling component, right? And so there's a balance that we got to do in regulatory compliance, the ethics, as you mentioned, Edie, that are important into the bigger picture there.
Yeah, and I'm actually concerned about time, so I'll try to summarize.
No, you're good.
Some really, really good ideas. But I'll start with the end, and then I'll move to how we began, because I think the end was super inspirational. It's not about reading the information. It's about understanding the information, perceiving the information, and having the conversation around the information that you understood. So that's super key. Multimedia might be a great way, and actually definitely better than just DocuSign or let's say So definitely have a lot of advantages, but we have to be aware that multimedia might not be for everyone. And we might think of more flexible mode with combining the documents, the videos, whatever is needed so that people can really, really get the whole information. Then regulatory they don't care what sort of an informed consent there will be, eConsent, digital consent, telehealth, whatever they call it. In the end of the day, teleconsent, I wanted to say, in the end of the day, what matters is that there is like the patient, like providing the consenting in a confidential, private and conversational mode, basically. And also one key thing, there should be a dialogue between the sites and the sponsor on what is the best solution, both for the sites and the sponsor, so that they basically work together as partners. I think that's not just about e-consent across the board, but there should be a dialogue. So it's not we pushing for our vendor and the rest we pushing for our processes, but ensuring that in the end of the day, there is a process in place, safety ensured, and there is a real informed consent in the end of the day. Thank you so much. And now we can